So thank you, Terry, for joining us. Tonight we're exploring the future of healthcare innovation and kick things off by featuring our 8 launch lane accelerator startups who are focusing on advancements in digital health. If you haven't had the chance to hear from them, be sure to meet them after the sessions today and look online. I'm super inspired from listening to their stories, and it's not just about their technologies, right, but about the comprehensive journey of startups in digital health. So anyway, for the audience, we're delighted to welcome Terry Talbot, who is the Senior Vice President of Strategy and Business Development, joining us to talk about Siemens Healthineers' approach to innovation and a critical role of corporate and startup collaboration for the greater good. So we'll leave time. I know we're behind schedule now. We'll try and catch up a little bit. We'll leave time for Q&A at the end, but feel free to raise your hand and ask questions. Or if you're online, please put the questions in the chat and the team will let us know. So, Terry.
Yes.
Can you tell us a little bit about your background, your interests? Tell us your story. How did you end up here?
Sure. So I watching all these fearless people and the phenomenal work that they've accomplished is inspiring to me. So I'm going to give you my background in fearlessness and risk taking, how I got there first, and then we'll skip all the boring parts. So I have kind of a dysfunctional Forrest Gump story for my background that some of the people who are here have heard already. So I went to the Merchant Marine Academy and I sailed around the world. Had a wonderful experience. And the next thing I did was I signed back up for Varian for a short period of time during during the Copacabana years, much to my shame, actually. And the first time, I have to tell you, the first time I told that story, because I kept it a secret forever, and we had a team event many years ago in the early 90s, and we were playing there's 2 truths and a lie, or 2 lies and a truth, whatever, a drinking game, whatever. And I shared this, and they didn't guess it, right? But then people knew that this was something in my background. So the first time I told anybody outside of friends and family was in the middle of winter in Fargo, North Dakota, at a huge health system. We were meeting about healthcare IT, and Barry Manilow happened to be in town. And for that night, one night only, in this I shouldn't say Cow Palace, but this, their arena, right, in Fargo, North Dakota. And I told them this, they thought it was wonderful. They all were huge fans. And they asked me what he was like. And I told them. And the response was so awful that I turned to my colleague and said, "You need to go start the car." We need to get so I'm not a fan, but it was a great experience. And again, it led to that fearlessness that I've had throughout my career. I also was an air traffic controller. And the thing I noted about them, I thought, should I tell this story or not? And I realized for the first time in my 40 years in healthcare, I'm in a room full of people, and I'm the oldest person here, and probably one of the only people who remembers Ronald Reagan firing controllers for striking. So I have to retire the story, I think, because it doesn't work anymore. But all those things really informed who I am today, and took me down this path of getting into healthcare, coming out of school. And I left air traffic control pretty quickly. It's a terrible job.
I heard it's kind of high stress.
Oh, it's extremely high stress. And you go to school at Will Rogers World Airport in Oklahoma City, Oklahoma. And at the time, the school shared a cafeteria with their medical wing. So you're there learning how to do this. And sitting across from you at the table having lunch are people there, are air traffic controllers for 20, 30 years who have all kinds of mental health issues, substance abuse issues. Not a good place to be. So I came out of there thinking I already have to get out of here. And they asked me to, I was at the DC regional center outside of DC near the airport. And after a year, they asked me to go to JFK and live in the tower of JFK. And I said, no, I'm going to do it. So that led me to SMS, which Eric Corkill of Eric's career. And many people here tonight came through SMS. So it was really a wonderful time to be in healthcare IT. And I spent many years doing that. And Siemens acquired us around 2000. And been with Siemens ever since. So a total of 38 years with Siemens because they grandfathered their time. And a lot of my colleagues in digital health at Siemens came from that SMS background because we had that healthcare IT. So it's always been, both places have been very entrepreneurial. You can come and make this, make a career that's not locked in. So many choices, so many opportunities. And given the opportunity to find collaborators, to look at new technologies. About, I want to say 6 years ago now, we spun off HS to Cerner, probably. 6 years ago, we divested our healthcare IT EHR at the time to Cerner Corporation. And we were left with kind of the dregs of the digital health offering. So over that past 6 years, we've built up a very strong digital health offering that is directly aligned with our mission in imaging and therapies. So it's we've come a long way since then. Well, we've got a tremendous amount of growth to do. So it's been a wonderful journey. The last 40 years in healthcare, and especially with Siemens, it's been a lot of fun.
Wonderful. So focused on Siemens, the purpose of Siemens Healthineers is to pioneering future breakthroughs in healthcare for everyone everywhere. So we're almost 2 years back. Just talking to someone today, can you believe it's been 2 years? I think that we've been in this a year, right? It's really hard to believe.
It never ended.
Never ending. One of the big takeaways here is that it's really amplified the inequities in healthcare and promoted rapid acceleration for new technologies and innovation. How has this affected your strategy, and kind of where do you see that pathway, the new normal?
So we're still, certainly like everybody else, we're still finding that path or those paths, but it really has changed the landscape for us, and certainly our customers, our healthcare providers, tremendously in terms of things that like telehealth, telemedicine, the huge explosion there, and how do we adapt to that? We had some play in there, but not a ton. So we're learning, how to be a player in telehealth, telemedicine. So that's a big change. We also learned how to pivot. This is Siemens is an aircraft carrier, right? So to turn the ship takes, again, I told you about the maritime background. It takes 10 miles, right, to turn. So we learned how to be faster, how to turn development more quickly, how to adapt more quickly. We created strike teams around COVID-19. How can we take existing technology that we have and adapt it to helping serve healthcare in this really difficult time? And we did some really cool things to help our customers with COVID from an early diagnosis standpoint, from ubiquitous access to devices. So we've learned a lot, and this is now, one of the things that happened in healthcare over that time early on was the federal government lowered the bar to telehealth, telemedicine, and the discussions we had early were, so what happens after? We have to roll all this stuff back, and I said, this is a genie you could never put back in the bottle, right? This is with us forever because it's the right way to deliver care. You talk about the underserved and trying to find a path to health deserts that are out there, rural areas and inner city areas that are underserved. COVID taught us how to do that better. So COVID is a tragedy in every respect, but we've taken that tragedy and learned from it as much as possible.
Where do you think the barriers are moving forward? Is it reimbursement? Is it access to broadband? Is it education, right? Because you've got to have the know-how to use the technologies, the willingness to understand that there's not like aliens in the background, like collecting your data, and, you know, manipulating things.
Cybersecurity.
Yeah. So how do you navigate all that for ongoing adoption?
It's not easy, and it's a continuing challenge to everything that we put out in the marketplace for sure, and also to find new ways to serve our customers. So I'll give you an example where we're now pivoting and coming out with a cybersecurity offering that we didn't have before, because you cannot be in this world. You know, certainly everything we do has cybersecurity built in, but our customers are looking for more than that from us. So we've got that development underway. We also have looked at how do we help our customers now deliver care in these disparate communities, because they want to do this now. You know, the barriers before were reimbursement, but reimbursement related to the cost structure, right? So I want to deliver better care or care in an area where I don't serve currently, but I can't make the dollars and cents work, you know, as a healthcare institution. Take a Jefferson or a Penn or whoever, any of the big players, even the small players that didn't have the financial wherewithal, didn't pay to do it, right? Which is a tragedy in our healthcare system, but it's a reality. So how do I change that? Well, COVID changed that for us. And all these things coming together, telemedicine, the need to provide services where I've never provided services before, just to cover a population that you can't cope with the numbers that are coming in the door. You know, all these healthcare institutions that were overloaded. And I got a call from the University of Michigan, a friend there, who runs the chairman of the imaging department, and he said, Terry, we're working with the National Guard to build a tent city on the University of Michigan's football field. And can you help me get some X-ray machines? I mean, we've never, you know, since I'm going to say World War II,
yeah,
never had to deal with anything like that as a country. So we learned from that, though, and everybody learned from that. So now those same people, you know, I talk to leaders across the country, healthcare system leaders, and they want to be in this permanently, which is wonderful. So they cared before, but my impression is they care more now, which I didn't think was possible. And then my colleagues will tell you that too. They see it everywhere. They want to serve, and the dollars aren't the factor anymore, right? But by the same token, our ability to deliver in those spaces for, you know, lower costs are building exponentially. So it's coming together in a really good time and a good place. And you know, how long would it have taken all of us to get there without this? Who knows?
Yeah. So you mentioned X-rays, and you know, engineering groundbreaking advances has been in Siemens DNA from the beginning with the first medical grade X-ray tube. And I think, you know, you've seen it throughout your career in the medical device industry, where it's evolved into, you know, building innovation solutions internally, then kind of swinging in the other direction, acquiring, right, new technologies. Now we're in this space of maybe kind of a hybrid approach, some joint development, some acquisition. How are you thinking about it and your playbook for fueling the culture of discovery and commercialization?
So that's a great question. For 170 years, Christian, we're thereabouts. We've been in the business of being Siemens and Siemens engineering, and there's a great pride that comes with that. Sometimes too much pride, right? So there was a long period of time where if we didn't invent it, it didn't need to be invented. It wasn't necessary, and we didn't need help from anybody. So that's changed tremendously over time, and again accelerated here. So we have now a need to be, we need to be in more places, in more settings with more delivery vehicles than we've ever needed before, and we don't have the bandwidth to do it. We don't have the expertise to do it. And sometimes it takes this kind of thing happening for us to get that message across, right? There were many pockets in the company that shipped 7 years ago, where collaborators, first and foremost, within, within the translational work that we do in the clinical environment. But those core, the core of the machines have always been us, right? So now we're in a mode that says we kind of don't care where the technology comes from, as long as we can make it work, right? As long as it's important to us, as long as it fulfills a need, right? And Eric, you or somebody referring to you made the point about you driving home the message of you have to get to commercialization. That's 100% true, absolutely true. So this is now how fast can we get to commercialization? If somebody can help us cut that short, or somebody has something we haven't thought of, we are 100% open to that now, which 30 years ago, not so much. So it's evolving.
So can you dig a little deeper on that, to talking about the importance of collaboration with startups, where we are and how you view that?
Sure. So it depends on the technology, depends on the fit. There are a lot of things that we look at. It can be very hard to break in to see us. I thought I'd come here and tell you the reality. The reality is it's very, very, very difficult. And I'll tell you a story that reinforces that. So I don't know who's familiar with HIMSS, those in healthcare IT. It's the premier international healthcare IT meeting that happens every year. It's so big it can only happen in either Orlando or Las Vegas, or San Diego, someplace like that. And we skipped one because of COVID. And had it virtually this year. They did a hybrid, and most of the vendors came out to be in Las Vegas, to be at this show, hoping that customers would show up, and being told by HIMSS, no disrespect, they hoped people would come, and people didn't. So we're out there with a smaller team, and we're bored, right? There are in Las Vegas, yes, watching paint dry while we're waiting for customers to go by. So it was at that point in time, the first day that we were there, that I got a text from somebody out of nowhere, and they said, "Hey Terry, we've got some cool technology. We'd love to get some time to talk to you about it." And if it wasn't 2021 and it wasn't this HIMSS, they never would have gotten a response. Because I have too many other things to do. I have too many meetings. I get this all the time. I'm jaded, all those terrible things, right? But that's the truth. This year, in this time, I pinged them back and I said, "Tell me what you got," in one sentence or less. And they did, and they said they were from Cleveland, and they told me what they were doing. And I said, "Oh, have you ever heard the name Mark Griswold?" And they said, "Yes. We work with Mark and he loves our technology." I said, "Come on up." And that started, a dialogue that's continuing, and I hope will bear fruit. But the point is not that they broke through. The point is that it's hard. So but I can give some advice on how to break through, and a lot of it you guys already have. You're persistent. You're risk takers. You're fearless. You need all of that and more to come and talk to us, or find a way to talk to us. And you need the right solution too. The best way to figure that out is to look at our landscape of not necessarily the products we provide, but the space we play in. And how does your technology help facilitate that, or help us grow a tentacle in a new direction, right? Because I'm not gonna be an EHR. at Siemens, right? We've got people who do that in the US. But I am going to get right up to that wall with technologies that will help me serve all of the other functions that I'm trying to deal with, right? Trying to provide. So come with that kind of view of, I understand where you play, and I think I understand where you might want to play tomorrow, right, in the future. And if you can do that, also come with a clinician. Come with somebody we know. Find somebody that we know. If you don't know who we know, go ahead and ask me, because I send you there first anyway. If you were able to get me to take a call, if you ever got through Franny, raise your hand. Okay, you are good. We had this discussion yesterday about somebody who got on my calendar, right? And they're not on my calendar anymore. It's just a matter of that, right? And priorities. Yes.
Homework's important.
Yep. So if you come, bring, you can bring a clinician with you from one of our partners. You might get heard. You probably will get heard by somebody. And don't give up with the first no that you get, right? Because you'll get some no's. And think about things, people equate this kind of stuff to Shark Tank, right? You haven't met anybody like us when it comes to Shark Tank, okay? I'm going to ask you the hardest questions you've ever gotten about your technology, about your thoughts about integration. So, I mean, some of this is goofy, you already know this, but role playing. Call Eric up and say, Eric, let me run by you my pitch for Siemens, right? And don't be afraid. Don't be afraid, because we're going to have fun with it anyway. I'm going to give you a hard time. Christian will give you a hard time. But you'll grow from it either way, whether you do something with us or not. So the key is to hit a spot where we're weak or don't play, and you have to be either commercialized already or very close. If you're bringing a technology that's very new, nobody's ever done, you have a better shot earlier with that. If you are coming with a Me Too or better mousetrap, we're gonna let the market shake out the players in that kind of space, and we'll partner with the one or two remaining. Because we want to be 1, 2, or 3 in every market we play, in every place we play. So if you're doing something better and you can defend it, then somebody who's in the market doing it already, you still need more than that. You need some traction, right? So find some pilots, find somebody small that that's a layup, and then get somebody more complex, and then come talk to us.
How do companies come to you, or does it make sense, and if not you, who, to figure out what are the milestones, what are the questions that you're going to want to answer to get your input, like not be a time suck,
right?
But that input's important to understand,
sure.
What you're looking for.
Well, this is why this kind of epiphany or awakening that we've had is leading us to things like Christian's involvement with you folks, right? That we realize we have to prime the pump, we have to ignite the spark to help get this dialogue going, to help push people in the right direction. Christian and I were involved in a tangential board associated with incubation for the National Science Foundation a number of years ago. And we hit our heads against the wall for 3 or 4 years doing that, and realized that it was so new, and at that starter level, at that grad and post-grad level, that it would be 10 years before something would come out, right? So that's not where we want to be. We do that with our collaborators in health systems. We do that with our own people. We'll do that through you, because you'll do the work and then bring it to us. If that makes sense.
Yeah.
But we'll mentor, we'll tap us to do that. Through Christian, we're looking at I'm talking with somebody who's building something that's even earlier than what you folks have built here, that's focused on diversity and acquired some warehouse space and building, an incubator for very young people.
So with digital health at the forefront, you've identified 3 competencies as a roadmap. So patient twinning, right? Being able to create a digital copy of the patient, precision therapy, creating more precise interventions, fully embracing digital data and AI as a foundation. And so what roles do you see startups playing in these areas? And more specifically, what makes sense? What's the makeup of the successful collaboration?
Sure. So I think the digital twin is a great place to start because we're going to create the expression of the digital twin. But the digital twin is the hungriest data beast known to healthcare. Absolutely, by far, by order of magnitude. So bring us something that feeds the digital twin from a healthcare data perspective, information that's hard to get, from an integration standpoint, how can we make the connections to get this information, and also on the expression side, use cases. Right? So this company that I mentioned in Cleveland that we got together at RSNA, the Radiological Society of North America, sorry, in Chicago, and they said, what do we do next? I said, okay, you take this one use case that's very limited, that I don't really want to play in, that you've commercialized. That's how they're going to do it, commercialized, right? And give me 3 that mean something to me. So that's their homework, right? Those are the things to think of. How can I take Siemens to some new place, some better place, building a better mousetrap. The work that the oncology, work that Andre's doing in Canada, right? I'm still on. That's pretty cool. We acquired Varian last year, and they're in the oncology space hugely. It was the biggest acquisition we've done in maybe ever in many years. And we're looking for new technology there in digital health. So we have, they have an expression of the work that they do on the consumer side. We have EHR vendors that deal with scheduling, which sound a little bit adjacent to Andre's space, but there was something interesting there that I probably would like to hear about some more, because we're looking for bridges now. So we acquired them, we're talking, we're bringing our digital health stuff together, and now I'm looking for a roadmap to what's the X plus Y equals Z, right?
Yeah, it's really interesting. If y'all aren't familiar with Varian and Proton therapy, highly recommend that you Google it. It's so fascinating and it's so big.
Yes.
So I toured Emory's Proton therapy before they cut off the underground to the public. So I saw the big system. It takes up a full block. And so to think about something that massive and complex, and then being able to layer on digital solutions on top of that, and the span of that, it's really fascinating on how that puzzle will fit together moving forward.
Yeah,
really kind of optimize patient experience and clinical delivery.
And that's what we're looking for is now that we've brought these two behemoths together, how do we make them both better?
Right.
And how do we make the delivery to clinicians and to patients better?
Yeah.
We got into that space many years ago, the proton therapy space, and people are stunned that it costs $25 or $50 million to do this, right? We came to the market with, I'm going to tell you a story of over-engineering and Siemens. We came into the market with an approach that said, this is too big a margin to look at in cancer treatment that these idiots are doing with proton therapy. We're going to invent something better. We invented particle therapy that created an opportunity to really pinpoint the cancer to treat just the cancer cells, right? And nothing overlapping. That costs $250 million a site to do. So we did 3, and now there's 1 left, right? So we got in and out and spent a lot of money to do that. And you know, it's listening to partners that said to us, okay, Terry, so you've got that pinpoint accuracy. Well, then you might be missing some of the margins, and it's too pinpoint. So, you know, this is we sure could use some help, right, to not fall down these holes, and for people to bring us simpler technology, better technology, and new inventions.
Yeah. Well, I know we're out of time, and I could talk about this for hours. It's so fascinating, and you know, the future of digital health, the convergence of devices in digital health. There's just such a tremendous opportunity moving forward as things converge to make a difference. So thank you for all the work that you're doing. I know we're at time, but I did say that we offer up questions.
First of all, thank you. Great presentation. My name is Glenn Hyman, and what I really like hearing tonight is that you're open to collaboration, number one. You're also open to, I think I heard, free revenue companies. That has not been the case with Siemens or Philips in the past. So that is a major change, which I love to hear. And then thirdly, I'd just like to make a statement about COVID. Long COVID, heart disease, liver, kidney. There are so many diseases that we're going to be hearing about long term from COVID. And companies like Siemens and Philips and GE, I mentioned those 3. Don't need to take anything away from Siemens, but you want to be 1, 2, or 3 in your market. There's 1, 2, and 3. Yep. So, love what I heard. I hope I didn't mishear anything, but maybe COVID did make a real change in the world because you see more collaboration, social collaboration, vaccines around the world, and I just think it's wonderful, especially with medical technology. There is so much out there that with a little bit of collaboration could help so much bring down healthcare costs, all right, and also save so many millions, if not hundreds of millions of lives. So I just wanted to say thank you.
Thank you. And you bring up a good point that I didn't press the button on too much. I should have. Think about reimbursement too. It's if we're going to adopt your technology, somebody's got to get paid somehow, some way. It doesn't have to be today. We can grow to that, but you have to have it somewhere in your plan.
Can I just challenge what you just said for a second? There is still, notwithstanding Obamacare, there is still a tremendous amount of free/charity care. And if you look at urban hospitals, especially, even if it doesn't produce a dime of income, it's going to save them tens of millions of dollars of free/charity care if you have the right technology in those centers. And I just want to make that point. So I agree with you.
Absolutely right.
Reimbursement, but I think there's also a place for technology that maybe isn't quite there with reimbursement, but yet can save these urban centers literally tens of millions of dollars.
Yes, you're right on it. It's reimbursement or cost avoidance. Yeah, anything that changes the equation from a dollars and cents standpoint. Yeah.
Thank you.
Other questions? So you heard some amazing entrepreneurs tonight, really cool technologies. What advice do you have for founders in digital health as you look towards the future?
Sure. This is something I don't have to tell any of the people who are up here, with their companies. But Eric Corkill's probably, in my 40 years in healthcare, embodies this more than the vast majority. Is persistence, right? And to take the risk and to stick to it and keep tilting at the windmill. I'm telling you all this stuff. I'm sitting up here. I developed some IP personally in 1999. It's still sitting on the shelf at Siemens. because I did it at SMS, even though it wasn't part of my job. I had to sign over half to them. And Siemens then got that in the acquisition. I signed it over to them. And it's still sitting there because I've been focused on all this other stuff. Don't be that. Don't be me. You're not. You guys are getting this done. You're making a difference. Don't give up. And I know you want to tell me stuff there. You wouldn't be here.
Well, thank you. Thank you for sharing your experience and wisdom and suggestions tonight. Thank you, Christian, for your support at the Science Center and to Siemens Healthineers for sponsoring our digital health. So join me in thanking.
You know, the goal in bringing the local team here that I work with is to have them engaged for the long term. So we will try to be stewards of what you're doing.
Appreciate it.